Welcome back. The doctor is in and we're talking kids with Lexington pediatrician Dr. Caitlynn Iddings. Today's topic, suicide prevention, which is all too prevalent in our country right now and specifically in children. So for parents, what are the signs that they can notice they need to get their child some help?
Yeah, so we were talking earlier, this is Suicide Prevention Month and Suicide Prevention Week. It's a topic that I think this is my third year doing this segment that I always like to circle back around to this month. The big things that we say look for, I mean, like most kids, they say 4 out of 5 who end up committing suicide have signs, right? And so things would be like they suddenly are more withdrawn. In teenagers, really a lot more anger, irritability. So if a friend's like, gosh, this person's like suddenly really aggressive and that's not like them, that can be a sign. Change of appearance, you know, not tending to personal hygiene, not wanting to shower, or someone who really was focused on their appearance just suddenly not caring at all, that could be concerning. Loss of interest in doing things that they used to enjoy doing. So the person who loves music suddenly quits the band, or the person who's all about sports suddenly doesn't want to be on the football team anymore. Those can be warning signs. And then of course the big one that is most worrisome would be what we call sort of like planning. So like starting to give things away that are really important to them, saying goodbye, or just making comments that sound suicidal, like I hate my life, or you'd be better off without me, or I wish I wasn't alive, can be things that kids can start to say that we definitely need to be paying close attention to. So yeah.
Absolutely. And you know, as horrible as it is, it does happen, and it's hard for kids, teenagers to understand. How should parents communicate that if someone close to them has committed suicide? Yeah,
absolutely. And what we always tell parents too, what I stress to them is they get this thought in their mind that if they ask, it's going to somehow plant a seed in that child that if they were sad or depressed, suddenly now they're going to start thinking about suicide. And studies have not shown that. So I always say it's always best to ask. So we have seen where there's sort of copycat suicides, or sort of this thing where like there's one in the community and then other kids start to have similar things happening. So making sure you're checking in on your kids when it is happening, asking them, have you ever had thoughts of suicide or wanting to harm yourself? Most of them are going to be pretty honest, and they're going to be glad that you asked them, right? Because it gets that out. It allows them to sort of have that release. Making sure that you're, as a pediatrician, doing these suicide screeners. We do those with every checkup starting at age 12. There's a specific question on there that asks, have you in the past 2 weeks had thoughts of wanting to harm yourself, or not being, or that you'd be better off not alive? And that one, you'd be surprised how many kids will check that their parents never knew. So making sure that if you don't think they're going to talk to you as a parent, that you have a friend talk to them, or a coach, or a youth pastor, or someone that you feel like they may be more open with if you're noticing those warning signs.
Well, thank you for coming on here today and spreading that information. It's very important. And make sure y'all stay with us. More Good Morning Kentucky is next.